about drugs that are likely to be in your medicine cabinet. And right now, researchers found that ibuprofen and naproxen increase a patient's risk of heart attack and stroke. Here to tell us all about it is Dr. Allan Magaziner from the Magaziner Center for Wellness. Thanks for coming in.
You're welcome, Lauren.
So is the ingredient we're worried about here acetaminophen?
Actually, no, it's ibuprofen,
okay,
which is in Advil and Motrin. So you have to be careful because these are now over-the-counter drugs. And so many people are using them on a daily basis, teenagers, adults, everybody's on these kind of medications. And what they found is it may increase risk of both stroke and heart attack.
So how much is too much?
Well, they didn't give an exact amount, but I'm going to tell you, if someone's taking them every day, maybe anywhere from 2 to 4 a day, you have to be very cautious, especially if you have a history of cardiovascular disease to begin with. So doctors need to be very cautious, and the public needs to be very cautious about taking these things.
Because it thins out the blood, is that why? Or?
No, they actually can cause damage to the heart itself, and also they also have problems with kidney troubles, liver problems, and also gastrointestinal bleeds at times. So these drugs are not benign, and we have to be very cautious when we think about taking them on a regular basis.
Is there a natural product you can take instead?
Absolutely, and that's what I do in my practice. We use something called curcumin, which is an herb. We also use something called boswellia, which is very good for aches and pains and arthritis. And also the fish oils, the omega-3s, work very similarly to what's called the COX-2 inhibitors, which are found, for example, in Celebrex, and it was in Vioxx and Bextra, which were taken off the market a number of years ago.
All right, I want to ask you about tinnitus. This is the chronic pain of ringing in your ears, very debilitating for folks. There's a new study out that says they may have found something to help with this.
They may have. I mean, this is a problem that affects probably over 23 million people, and 40% of the military veterans are troubled with tinnitus. This study now looked at rats so far. So we're going to be running some human studies soon. What they found is that something called the vagus nerve stimulator, the vagus nerve runs from the head down into the abdomen, and that this stimulator may help when it's combined with certain tones to offset the problem of tinnitus. So it may be a very encouraging finding that we're going to look into further now in humans.
Because there's no cure, do we know what brings it on?
We don't really know. That's been the mystery so far, but somehow there's a change in frequencies in the brain stem in relationship to the auditory cortex, which is how we process sounds, and we hear some people are really debilitated by this tinnitus.
Yeah, it sounds awful. All right, Dr. Allan Magaziner, thanks for coming in. We appreciate you taking the time.
Thanks for having me.
And in tonight's